morning, everyone. I'm Dr. Akkapon Poolcharoen, hematologist and bone marrow transplanter. I'm specialized in treating hematologic disease, both of non-malignancy and malignancy. And I also expertise in stem cell and bone marrow transplantation to treat certain type of blood cancer, lymphoma, or some kind of hematology disease. So this patient, he has diagnosis with some kind of leukemia before he came to our hospital. But after we complete investigation to confirm diagnosis, so we found that he got a specific type of acute myeloid leukemia that we believe is transformed another type of blood cancer, which is chronic myeloid leukemia. I think today compared to 20 years ago, the field, the knowledge and the technology in the transplantation field advanced so much in the past few years compared to the past. And in our center, we specialize in another technique of the transplantation that we call haploidentical transplantation. So this kind of technique can overcome the barrier of donor finding. In the past, the most of the transplant center in Thailand, we can do only the matched sibling transplantation. So for the people who are older than 50 years old, finding donor is a major barrier to provide this treatment to the patient. But since we expertise in haploidentical transplantation, so we can select a family member, young son or the son or the girl, the daughter can give stem cell to their parents. At the same time, young parent also can give stem cell to son or daughter as well. And because when we pick donor from family, it saves time to find donor. Because for some certain type of blood cancer like acute myeloid leukemia, patients don't have much time to find donor. They cannot wait several months for donor. So if you can pick family member, saving time, saving money, and for the schedule of transplantation, it's in your hand. You can decide when to start. You can control everything. Also, you don't have to worry much about ethical issue because this is the blood relative family member. For Mr. Poolcharoen, we know that he got acute myeloid leukemia with bone marrow myelofibrosis. So in his condition, he really need to do transplantation. But he has only son. He doesn't have the sibling that's suitable to be his donor. So because his son is only 15 years old at the beginning, his son is quite worried and he afraid that he can be a donor or not, or the stem cell collection process will be painful or not. So we start with educate donor, give him the detail of the donation process and encourage him to help his father. And he is a good boy, he is a good son. He knows what he has to do. Even at the beginning, he afraid about this procedure, but he realized what's going next. He realized that he needs to help his son. Then he really happy to do that. And we have a lot of publications around the world. We know that young donor is very, very important to the transplantation outcome. This is the example of when we select the appropriate donor, we will get the best outcome of the treatment. In our transplant center, the successful rate is almost 100%. And for this patient right now, he is in achieve complete remission confirmed by genetic test. We have done RQ-PCR to detect BCR-able gene mutation, and the result is show undetected after transplantation. And we keep monitor now already 3 times after transplantation, but also show the undetected, which is a good result. And the patient condition is very good. He didn't develop any complications like acute graft-versus-host disease, or now is already 100 day after transplantation, but he also didn't show any sign of chronic graft-versus-host disease. So in terms of disease control is very good. Also the complication, the major complication of haploidentical transplantation, which is graft-versus-host disease, he didn't develop both of acute and chronic graft-versus-host disease. So it's very good. I always emphasize patients since the first consultation. Transplantation is not only the time that you admit in hospital 30 days. No. The transplantation, if you want to get the best outcome, it starts with the first day, the first consultation. You need to realize and you know what's going. You follow our recommendation. You share any abnormality that you might detect in the future. Also during the time of admission, but I'm not worried much about the time of admission because the patient will be in hospital. We monitor everything. Me and our team, nursing team, we monitor 24 hours and every day that he will be in hospital. And then the most important, after discharge, first 100 days. So even patient already discharged from our hospital, but we keep contact with the patient. We have emergency line and emergency chat program that the patient can contact and report any abnormality 24 hours. And me and our nursing team, we are happy to take the patient question or any patient report. That's what the reason why in our center the transplantation is, the outcome is quite impressive in terms of disease control and complication after transplantation. The first, just please do not listen to only other people says, because a lot of patients who come to talk to me first time, they're all afraid about disease. I will be cured or not. The second is they're always afraid about the complication of the treatment, both of chemotherapy and the transplantation. They may hear a lot from other hospital, other center, but please come to get consultation with us, and then we're happy to provide the information. Please do not afraid about the treatment or about the disease.